President Bush likes to say that voters know best what to do with their taxes, and today in Oregon, citizens are putting that theory to the test. In the balance are the lives of 100,000 children. Our third story tonight, Oregon Tonight flashpoint in the national battle over health care for children of lower income families. On the ballot today, Measure 50, which would boost the tax on a pack of cigarettes from $1.18 to $2.03 and give 100,000 kids health insurance. Supporters of Measure 50 have raised a little over $3 million for ads like this, with the backing of state Democrats and Oregon groups including hospitals, doctors, insurance companies, the PTA, seniors, firefighters, churches, nurses, social workers, unions, the State Business Association, and local chapters of the American Lung Association and the March of Dimes. Opponents of Measure 50 spent almost 4 times as much, $12 million, with the backing of state Republicans and Oregon groups like R.J. Reynolds of North Carolina, Philip Morris of Virginia, and Grover Norquist's Americans for Tax Reform of Washington, D.C., best known for serving as front for Norquist's old pal Jack Abramoff, all helping to make Measure 50 the most expensive referendum battle in state history and a litmus test for the future of health care for America's kids, including the bipartisan S-chip expansion, which Mr. Bush enjoys vetoing so often we might as well start including it in the weather forecast. Joining us now, healthcare documentary filmmaker Michael Moore, whose movie SiCKO launched today on DVD. Michael, welcome back.
Thanks for having me back, Keith. So I guess basically the point is that the people in Oregon better keep smoking so that the kids can get health care, right?
I guess I'm trying to figure it out because it is the Republican template here. Make any public health care, pay for itself, show some future savings. In this case, the state of Oregon would save millions later for health care for people who wind up not smoking. And you have the Democratic ethos to it, which is more health care for poor kids and reduce smoking. Why do Republicans, why would anybody not materially involved in the production of cigarettes oppose this?
Well, that's a very good question. I guess the Republicans have kind of figured out that their days are up, and they might as well go out smoking or something. They're certainly not going to do what's right for the people. What's odd about it is you'd think they'd want to at least put up a fight to try and get reelected next year, make it appear that they're for kids. But you know, I think what's sad about this is that there even has to be a referendum, and that you, again, like I said, you're going to have to depend on people to keep smoking so you can tax them so the kids can see a doctor. I mean, it's such a crazy-ass way to go about providing health care for our citizens. Why don't we just do it like every other Western industrialized country does it, and provide free and universal health coverage for all of our citizens? It's an easy thing to do. We have so many examples of how it can be done. What's the problem here?
Well, obviously, and you know what the problem is, that there are vast forces allied against it, and it likely is not going to happen instantaneously. But the one thing that about Measure 50 that is so striking, the insurance companies actually supported it. What do you make of that? Is that like a horizon with a sun on it after about 6 months of rain?
Not really. The insurance companies are behind that, and they're behind S-chip too, because, again, remember, they like the idea of tax dollars being spent on a healthcare system that essentially is still controlled by them, and where our tax dollars go to them, where they provide the insurance. And this is where, frankly, the Democratic candidates, the 3 frontrunners, are wrong with their proposals, where they still are allowing the private insurance companies to have a seat at the table. They have a vested interest in making profits, not in taking care of people who are sick. And so, you know, these plans, especially, I have to say, the Democratic plans of the 3 front runners are still going to be about siphoning our tax dollars into the private insurance companies. You need to they're the middleman that doesn't need to be there. They're the racket that's set up to, even when you have health insurance, you can't get help because you've got a pre-existing condition, or because the copay is too expensive, or the deductible is too much. We just have to get rid of this and get behind the John Conyers bill in Congress, H.R. 676. And that's the universal health care plan that the candidates need to get behind, and the public needs to get behind.
All right, I get the point on this, but what I don't get, the one thing I've never really followed, is who profits if this is driven in so many quarters by self-interest, or in all quarters by self-interest. Where's the self-interest? Who makes the money off the fact that 50 million people are not insured in any way?
Well, the people that make the insurance companies make the money by denying care, and I mean that goes back to Nixon when he and Ehrlichman and Kaiser all came up with this HMO idea, where they said this is going to be really cool because the less care that doctors provide, the more money we all make. And so that's been the system we've had pretty much since the 70s. But your older viewers, people who remember the earlier days of when there was health insurance. I mean, my dad worked in the GM factories, UAW health insurance. There wasn't all this business of these expensive co-pays and deductibles, and you couldn't afford the medication. It's just you had health insurance, you got sick, you went to the doctor, you got well. And that's where everything was going until, unfortunately, the last 20 or 30 years, and it's just been downhill since. And frankly, I think this isn't going to turn around with halfway measures. And I have to say, as much as I hope the Oregon thing passes tonight, ultimately that's not going to be the solution either, depending on people smoking to pay taxes so that kids can get help. What is wrong with us here? Let's just get to the business at hand, which is making sure every citizen is covered. When they get sick, they can see a doctor and not have to worry about it.
And we eliminate the real-life version of the old Monty Python sketch, which was literally the guy walks into his insurance agent's home or office and tries to get a payback off his claim or make a claim, and the guy goes, "I'm sorry, you signed for our never pay policy." And we have it now, and this is 40 years ago. But now, in the movie, in SiCKO, you showed a clip of the president speaking to a woman who has to work 3 jobs to support her kids, and instead of seeing this as some sort of issue that he might want to do something about, he says, boy, it's great, it's uniquely American. What vision of America did he reveal there?
His and the Republicans and corporate America's vision, which is that the rich get richer and everybody else fights for the crumbs. Everybody else has to work harder, work longer hours for less pay, less benefits, less vacation time. And we've been on a bad roll with this. And unfortunately, these last 7 years, this has just been a disgusting time. You know, I just had dinner with a friend here in Michigan tonight he has Parkinson's, and he said to me, you know, 7 years ago this week, when that election was stolen, that night, that was my death sentence, because he knew then there wasn't going to be stem cell research. There wasn't going to be the money dedicated to this. You know, the things that America used to be great at, of tackling problems and going after what seemed to be the impossible and making it happen, those days were gone. And he was saying how, you know, he's not going to live as a result of what's happened in these last 7 years. That's a tragedy, and there's a tragedy happening every night here in this country as a result of this. And I'm just hopeful that we'll be able to turn this around next year, and I'm demanding, as are millions of citizens, that the Democratic presidential candidates get with the program here and do what is necessary for the people. Halfway measures don't work.
Michael Moore, his latest documentary movie, SiCKO, hitting stores in DVD form today. If you haven't seen it, you must, as we've all signed up involuntarily for that never pay policy. All the best, Michael. Thank you.